At just 21 years old, Emily Brown has spent half her life battling cancer.
The prognosis was bleak. We found out that I probably had about 3 months to live, Go do what you need to do and live how you want to live for those 3 months.
It's an extraordinary journey, and that's the only way to describe it. It is.
A pediatric oncologist from the University of Colorado's Cancer Center, Dr. Leah Gore, has been by her side during the highs and lows.
For 10 years, I've been cancer-free. She has been friend, counselor, doctor, part-time mother. She has been everything for the whole time.
One of the things that happens is that new and exciting treatments that come out in the news that you hear about on television, oftentimes there's a 5 to 7 year lag before those drugs actually get to children with cancer. And so we've worked very hard to try to shorten that period of time so that we can bring exciting therapies to kids quicker.
And we did not know it at the time, but if you put it in the brain or against the spinal cord, that small amount of platinum is horribly toxic. And we learned that in dogs.
Early in her cancer journey, Emily received help from the veterinary oncologists at Colorado State University's Animal Cancer Center.
That'll help us determine level of concern. Having Emily Brown come up to CSU the other day was certainly motivational for me and did tie together why we're here, why it's important to decrease the side effects of our treatments, and why it's important to increase the benefits of our treatments. And that ultimately it's a breathing living person or a breathing living dog who's the beneficiary of all this work. What I'm going to encourage her to do is to participate in one of the clinical trials.
On a whiteboard in the rounds room of the ACC, oncologists have mapped out numerous clinical trials for animal patients who have run out of options.
And then we do MRIs and biopsies.
Emily looks at the board in amazement and sees nothing but hope.
And answer the questions fast. That's one of the big advantages.
My chemo started here, and it was translated to a hospital at CU. Then it was given to me. I wouldn't be here if it weren't for CSU and CU working together, and working together very, very well.
Seeing Emily here, she is as proud of the relationship between CU and CSU as any of us. It's symbolic of the partnerships that we've been able to forge.
Emily is the face of cancer research in Colorado. She's alive because 2 world-class institutions joined in the fight against cancer.
There's only one enemy, there's only one goal. That's to get rid of cancer, and we do it better as a team than we do individually.
So we can't do surgery while it's at its peak.
And the reason is that cancer is cancer. Animals have cancer, humans have cancer.
Be good.
CSU is probably the best place in the country to be treated if you happen to be a Labrador with cancer. If you're a human with cancer, CU is one of the best places in the country to be treated.
Here's a good boy.
The pets always get very good care, and the doctors there talk about their patients the same way we talk about our patients.
I mean, that's just a mild to moderate amount of fluid. That's not a lot. Most cats with this are not going to be in respiratory distress. In the area of cancer research and our efforts to fight cancer in all species, people and pets, the only thing that separates CSU and CU is the letter S. I mean, we are on the same page in terms of what we're trying to do in our research.
The animals that are treated here are treated not as laboratory animals, they're treated as patients, and that intent to treat and the careful scrutiny of toxic side effects and all the things associated with cancer therapy in humans, I think makes them a better model.
So you've actually made this drug work. So that must mean it works more than 100 times better. So you take those 2 very different on the face of it things, and you then combine them together. And what you get is a synergy where the knowledge that we get out of working together and complementing each other in the ways that we do leads to us making faster progress, learning more than we would have done otherwise.
This multifaceted collaboration has a 20-year track record, but today there's an unprecedented amount of sharing expertise and swapping ideas.
We really have
an opportunity to interact with some just great minds at CU, bounce ideas off of, share interests, and that's really springboarded a number of collaborations.
You're actually speaking not as a single investigator who's doing this testing, and so when you talk about the program, the science, you really present it with a level of confidence that I think only comes because you have that collaborative team in place.
And I think the one thing that the citizens of the state can be proud of is how our institutions, when they have found an area to work in, that we're not trying to compete with each other over it, we're trying to collaborate.
Researchers spend time developing new targeted drugs or improving imaging techniques.
Susan was for me in the beginning, and she continues to be just a very good mentor and like a senior faculty. She's always very positive, she's always very full of ideas.
She brings to the boards the biochemistry, and I bring to the table the animal imaging background, and so I'm able to help her with her work and she helps me with mine.
This is a new study with bone tumors at CU again with Dr. Duke, where we're looking at fast ligand.
Animal owners obviously are as loyal to their animals as they are to their family members in reality. This does give them a unique opportunity, however, to participate in a study that could not only benefit their dog as well as other dogs, but actually humans as well.
This is Igor, and he has osteosarcoma, and Igor is involved in a clinical trial that is a good example of one of the projects that we're working on concurrently with some investigators down at CU.
This interaction really could only take place in the kind of center where there's an understanding of both the clinical need on both for the canine population, but also for the human population.
There are many examples of drugs that are being developed here where the original studies are being done in animals at CSU. And those collaborations, again, are more plentiful and are easier because we're all members of the same team.
Better outcomes for pets generates the knowledge needed to help people. Researchers from both institutions have enthusiastically embraced the relationship, creating a new path for discovery up and down I-25.
It's very clear to me from my own research that having another lab to work with, having a place that has certain expertise, allowed us to get grants that we could never have gotten on our own.
What we're trying to foster is sort of a northern Colorado hub of cancer research or cancer innovation that spans a number of different disciplines, from very basic science through what we do, which is translational medicine, through clinical applications of these.
We have the potential to really being one of the preeminent programs in the country in terms of how people are being treated today, but we will be leading the path towards new treatments.
We can't tackle cancer in isolation. You can't just look at one aspect of cancer. We have to have people with skills in all areas. And for a state like Colorado, we have those people. They happen to be in different locations and at different institutions. But if we bring them together and they start working together, we actually are going to cover all the bases.
There is not another sort of environment that has this degree of collaboration and this degree of really, really smart people sitting around putting their heads together.
Everyone feels comfortable that we're in here for the final end game, which is how do we do our best to make cancer a thing of the past.
Today we're going to shave Emily's head. Mike has already shaved his head.
Emily shaved her head to raise money for cancer research. She knows what it takes to deliver expert, compassionate care. She also knows what can happen when two focused universities pool their talents to create discovery and hope.
They really need to have that partnership. I mean, otherwise there won't be the strides forward that they've had so far. Together, they are absolutely 100% that much better.
There's still cancers that are currently considered incurable, or even if they're not incurable, the therapy has such high toxicity, and really the goal for this is to try to do better at both of those things. And without an incredible collaborative relationship, it's not going to happen.
The future looks bright. Two institutions, one goal, and many success stories yet to be told.
You and your group, Emily,